Good evening, students. A very good evening to one and all. I hope you all are doing well. Today, we are going to discuss regarding the exam preparation session. As you are approaching your exams, I know you all must be busy studying and preparing for it. So let's just quickly discuss one of the question papers. But before I move on to the question paper, let me just explain you the pattern of the question paper. So the question paper will consist of essay, short answers, and very short answers. Among essays, you will have you'll have two questions. Each question will have another two questions, which will be an option for you. Like first question will be having A and B sections, which will be an option. So you can either select the A part or the B part. The second question will also have an A and a B option. Okay. And among this, you can select either the A part or the B part. Now, each question for you is 10 marks. The essay will be 10 marks. So, in total for the essays, you will be getting 20 marks and you will be attempting two questions. Okay. So, from first will be your essay. In essay, you'll have two questions. Each will have a sub question, that is A and B, which will have an option. So you can either choose A or you can choose B. Same thing goes for the second question. You can either choose A or you can choose B. It's up to you. So whichever you're well versed with, okay, make sure you select that question, which will fetch you more marks. Okay. Now for the essays, make sure anatomy requires diagrams. So you need to draw a lot of diagrams in anatomy. Okay. So for the essays, make sure you draw minimum of 2 to 3 diagrams for sure. Okay. As many diagrams as you can draw, that will be really, really good. Draw appropriate and relevant diagrams. Try using colors for the diagrams. Okay. The diagram need not be very artistic or something, but it has to be anatomically correct. And try to use colors, try to draw at least 3 diagrams. And in essays, for saving time and also to make it more effective, you can also use flow charts. Okay. So suppose now in this case, for the axilla, you can just explain what are the boundaries and what are the contents of the axilla briefly first by using a flow chart, and then you can describe that flow chart. Suppose a nerve is asked for you. Nerves can be very nicely described using longitudinal flow charts. Okay. You can also use flow charts to explain the joints. If classification of joints is asked, there also you can use a flow chart, and there only you can write the examples for each joint. Okay. So wherever appropriate, try using flow charts. Okay. Try to draw as many diagrams as possible, and definitely you have to use colors for the diagrams. Okay. You don't have to fill pages and pages. Nobody is going to count how many pages you've written. Your content or whatever answer you're writing should be appropriate to the question asked. Okay. So write appropriate answers to the questions which are asked. Write the relevant answers. Write in bullet points. Underline the keywords. Okay. Or you can use 2 different colors to, underline the heading, or you can just underline the main keyword for that particular answer. Right. And diagrams can be self-explanatory also. Suppose, for example, superolateral surface of brain is asked. Over there, you can draw the superolateral surface of brain, sulci and gyri you can draw, and there itself you can write. So this is the central sulcus. So from where to where it is extending, like that. Okay, so make your questions and your answers a little bit more innovative. Okay. That will help you save time also, and it will be more effective when you answer the question. Okay, so once again, I'm repeating. Your first part will be your essay. Essay will have 2 questions. Each question will have a sub question A and B. So you have option for A. Now, for the first question, you can either choose A or B. Same thing goes for the second question. You can either choose A or B. Make sure you always attempt the question which you are more thorough with. Okay. You have to draw minimum of 3 diagrams. Use appropriate colors for wherever required. Like if you are suppose drawing the blood supply. Okay. So the arterial supply, you will use red color. For venous drainage, you will use blue color. Okay. For ligaments, you'll use green color. For nerves, you'll use yellow color. For muscle origin, you can use brown or orange. For muscle insertion, you will use blue. Okay. And for lymphatics, you will again use green or purple, right? So these are some of the color codes that you have to strictly follow. If you're drawing only the bone, you can use your normal lead pencil to draw the bone. Or if structure of neuron is asked, in that case also, you can use your normal lead pencil to draw the structure of neuron. Okay. So these things are certain things that you have to always keep in mind. We'll move on to the next part of your question paper, which will be short answers. So you will be given 8 short answers. Okay. So we'll have the 8 short answers and each is for 5 marks, as you can see here. So 8 short answers, 5 marks each, that comes to 40 marks. Your essays are 10 marks each. Okay. So you'll be attempting 2 essays, totally of 20 marks. Now your short answers will be, you'll have 8 short answers, 5 marks each. So totally that will come to 40 marks. Okay. Now short answers also, for short answers, make sure you draw at least 1 diagram. Okay. Long answers or essays, you'll draw minimum of 3 diagrams and 2 to 3 diagrams. And for short answers, you have to draw at least 1 diagram, right? Now, short answers, see, this is one place where many of you will not be able to manage time, okay? So what you do is you leave off lot of short answers and there you will lose your marks, okay? So you have to be very good with the time management. If your paper is for 3 hours, your essays are 10 marks and 10 marks each. So you give at least, 30 minutes for your essays. So make sure you finish off your essay in that 30 minutes of time frame, right? So that will take off your 1 hour. Remaining, you have 2 hours. So you have to give at least 10 minutes for each of these answers, right? So your short notes will actually take time. And these are the ones which are actually scoring, both your short notes as well as your very short. They are extremely scoring, okay? So you should not miss any of the short notes or very short notes, right? And make sure to attempt all the answers. Don't leave the answers. Try to attempt as many answers as you can, and write something relevant. Don't write something which is totally irrelevant. Okay. Suppose muscles of mastication is asked and you have not prepared it, you don't remember, but at least something you'll know, right? For chewing, what are the muscles which are used? So muscles in this area are used generally, right? So whatever muscles you remember, like we have the masseter, medial and lateral pterygoid, at least the relevant names of the muscles you write in case you're not sure of the answer. Don't write something which is totally irrelevant, okay? If you're not at all sure, in that case, you have no option, then you leave it instead of writing irrelevant. But if you have vague idea of any question, then make sure you attempt that question. Don't leave any question unattempted. Or at least if you vaguely remember some diagram with regards to that question, then you draw that diagram. It may not be 100% perfect or 100% right, but something relevant to that particular question you have to draw and write. Okay. So once again, your first part of the question paper is your essay. Again, I'm repeating, essays, there will be 2, okay? And each question in the essay has 2 sub-questions, which is an option. So you can choose, compulsory you have to choose 1 question from, from first question you have to choose 1 and from second question you have to choose 1, okay? That is mandatory. You can't write both the questions of the first one and leave the second one. You cannot do that for the essays. You have to write the first, from the first question, like here you can see, from the first question, you have to attempt either this or this. And from the second question, you have to attempt this or this, okay? But first and second question, both you have to attempt. It is mandatory. And each of this carries 10 marks. Short notes, 8 short notes are given, each carrying 5 marks each, isn't it? So I told you one diagram is compulsory for 5 markers. Here also you can use flowcharts. Okay, you can draw diagrams, and those diagrams can be self-explanatory, right? So it depends how well you manage time. It depends on that. Okay. For essays, you try, if your paper is for 3 hours, try to finish off your essay within an hour. Okay. And then your short notes, you will need at least 10 minutes, 8 to 10 minutes for each answer. Okay. Finish that off. Right. So that will take another 1 hour. Actually, 1 hour 60 plus 20, 1 hour 20 minutes it will take. Right. So you'll have another 40 minutes left with you. Last 10 minutes, you leave it for rechecking and if you've missed anything, right? So two and a half hours is over roughly, and you are left with another half an hour. So you will require another half an hour to finish off the short notes. So you'll have 10 short answers carrying 2 marks each. So here we, now for example here, when transitional epithelium is asked. So in this case, you can only draw the transitional epithelium, okay, and there only you can explain it. Okay, so this is transitional epithelium, example where it is found, okay, in the it is a urothelium, so it is found in the urinary bladder, urethra, etc. And there only you can explain what are the layers. So basal lamina, basal cell, that is the columnar cells, pear-shaped cells, and umbrella-shaped cells. So that will be your transitional epithelium. Like that, wherever you can, you draw the diagrams, but it's okay if you don't draw diagrams for 2 marks also. If you can just explain it, it's okay. But if you feel that drawing the diagram will save you time and you can explain also, that will also be good. Like for example, bregma. So bregma is the meeting point of coronal suture and the sagittal suture. So this, if you draw one, the skull cap, the vault of the skull, if you draw and you show the meeting point of bregma and meeting point of coronal and the sagittal suture, that will save you time. Okay. So don't give more than, more than 2 or 3 minutes. So 3 minutes is ideal. 3 minutes, 10 questions. So that will be your 30 minutes. Okay. You're still left with 10 minutes in the last. So those 10 minutes you can use for referring something, or if you have left any question previously, for checking that you have not missed any question, for checking the question numbers. Question numbers also you have to write correctly. Many of you make mistakes with the question number. Okay. So all your papers will be scanned and they are put up on the site for us to correct, right? So you should not go wrong with the question numbers. Okay. You have to check the question number, you have to check the Roman number, like Roman number 1 will be essay. So under essay, which question and which sub question are you attempting? Under essay, which second question and sub question. So all that you have to be sure. You have to write the question numbers also correctly. Okay. So these are some of the common instructions. I'll just repeat once again. So your paper, your total paper will be, your paper will be for 80 marks. Okay. And for 3 hours, I guess. And so you have to manage your time, right? Please carry your hall ticket, your pen, pencil, color pencils. Okay. All of that. And be neatly dressed, right? And when you go for the exam, as soon as you get your question paper, first go through the question paper properly. See which question you're sure of. Okay. You can attempt short questions also before. You can attempt very short also before, but don't mix it up. Like if you are starting with short answers, then you complete the short answers and then you move on to the very shorts. Okay. One short answer, one very short answer, one essay. Don't do that. Okay. So if you're writing the first Roman number, if you have chosen the essay, first to write. Then in that case, you first finish off both the essays, then you move on to short notes. If you're starting with short notes, then you write the short notes first and then you move on to essay or very shorts. Okay. Now, essay will be your first Roman number. In that, you'll have two questions. Both the questions you have to attempt. They are mandatory. Each question carries 10 marks. Okay. And each question has sub questions A and B. This A and B, you have option. You can choose whichever you want to choose. Okay. And then the second question, again, same thing. It is mandatory to attempt both the essays. I'm repeating again and again. It's mandatory to attempt both the essays. Okay. So first question you will have option. Second question also you have option. But you have to attempt only one from the first question and one from the second question. Next, very shorts will be 8 in number. Each carries 5 marks. In essays, you will be drawing at least 3 diagrams. In shorts, you have to draw at least 1 diagram. Okay. You can use flowcharts also. That's up to you. But it will be nice if you use flowcharts, especially for nerves, blood supply, classification of joints. Okay. Even embryology. Embryology also, you can use flowcharts to depict the spermatogenesis, oogenesis, and all. Okay, so that will make it easier for you to remember and easier for you to present it, and it will be time saving also. So wherever you can, you use flowcharts. Wherever you can, let the diagrams be self-explanatory and use the diagrams. Okay, for very shorts or very short answers, there will be 10 questions carrying 2 marks each. Okay, so here also, wherever possible, you draw the diagram and explain it with the help of the diagram. And rest of the places you write the answer. Always write the relevant answers and try not to skip any question. Please make sure you're writing the question numbers correctly, even the Roman numbers correctly. First Roman number is essay, so you'll write essay and the question number correctly. Okay. Wherever possible, underline the keywords, right? And draw well-labeled diagrams. Diagrams should be well-labeled. Diagrams should be drawn with pencil only. Don't draw diagrams with pen. Okay. Once you draw with pencil, use appropriate colors. Like for artery, as I already told you, it's red. For veins, it is blue. For lymphatics, you can use green. For muscle origin is orange or brown. For insertion, it is blue. Okay. Lymph nodes is again green or purple. Ligaments is green. So make sure you draw these using the appropriate colors. Okay. I hope I'm clear so far. Anybody has any doubts? Okay. Now we'll move on to the discussion of the questions. So here, as you can see, the first question is describe the boundaries and contents of axilla. So in this case, we are discussing about the axilla. Axilla is the armpit. Okay, then you have to mention about the boundaries. So how many boundaries does the axilla have? It has an apex, it has a base, it has anterior wall, posterior wall, medial wall, and the lateral wall. Okay, and then you have to explain about the contents of the axilla. So it will have the brachial plexus, axillary artery, axillary vein, right? So all these things you have to discuss a bit in detail. So first you can draw the diagram of the axilla. You can explain the boundaries of the axilla, what is forming the roof, what is forming the floor, what is forming the apex, base, medial wall, lateral wall, anterior and posterior wall. What are the structures forming these walls? You can explain. And once you've explained that, you can mention the contents and then little bit more in detail about the contents of the axilla. Okay. Next, coming to the gross anatomy of left lung. So if you come to the left lung again, you can mention what are the diameters of the lung, what is its location. It is located in the mediastinum. You can mention about that. What are the coverings of the lung? So we have pleura, the parietal and the visceral pleura is present. And then each lung, or here we are discussing the left lung. So it will have an apex, it has a base, right? And then it has the border. So it has the anterior border, posterior border, right? And it has the fissure. So how many fissures does the left lung have, that you have to discuss. Okay, one fissure, dividing it into two lobes, right? And then you can discuss about each lobe and the bronchopulmonary segments which are present in the left lung. Then you can mention about the relations of the left lung, like what is it related on the costal surface, diaphragmatic surface, then its relation on the mediastinal surface, and its relation on the posterior surface. Okay. Then you can mention about the nerve supply of the left lung. So all these features along with the diagram. So what diagrams can you draw here? You can draw the diagram showing the bronchopulmonary segment. You can draw the diagram of the mediastinal surface of the left lung, right? Apex, base. So all these things you can discuss in the left lung, right? Next, coming to the stomach. So if you see the stomach here, they have specifically asked the questions. So when the questions are specifically asked, then you can just put the number. Like first question is openings of the stomach. So stomach, it has cardiac orifice or the cardiac opening and the pyloric opening. You can mention that. Then what are the parts of the stomach? So parts of the stomach will include the cardiac end of the stomach, okay, pyloric end of the stomach, body of the stomach, fundus of the stomach, and the complete pylorus of the stomach. So those will be the parts of the stomach. Then arterial supply. So stomach is supplied by the right and the left gastric arteries, which form anastomosis along the lesser curvature, right and left gastroepiploic arteries, which form the anastomosis around the greater curvature, and then some branches from the splenic artery. So all this you have to mention with a well-labeled diagram. Okay, next we have the origin, insertion, action, and nerve supply of tendocalcaneus, of muscles forming the tendocalcaneus. So whenever any muscle is asked, you have to mention origin, insertion, nerve supply, and action. Okay. Now tendocalcaneus, so tendocalcaneus or the Achilles tendon, it is mainly formed by three muscles, isn't it? So we have the two heads of gastrocnemius, which are forming a common tendon. To that is attached the soleus, tendon of soleus, as well as the plantaris muscle. So all these together are forming tendocalcaneus. So you can mention the origin, insertion, nerve supply, and action of each muscle here. So that is about the essay, as I already mentioned. So first will be the, from first you can answer either axilla or gross anatomy of left lung, any one of these. And from second you can answer the stomach or the tendocalcaneus, any one of these. Next, coming to the short answers. So short answers, they are generally 5 marks each, only one diagram. So when menisci of knee joint is asked, okay, so you can mention about the right and the left menisci, the shape of each meniscus, okay. One meniscus is semicircular, one is circular, okay, where it is present, how many compartments it is dividing the knee joint into, okay, and what are the structures that it is attached to. It is a fibrocartilaginous disc. All this you have to write about the menisci of the knee joint, okay, the right and the left meniscus. Next, muscles of mastication. So again here you can mention there are 4 muscles of mastication, and for each muscle you can mention the origin, insertion, nerve supply, and action. So 4 muscles of mastication will be masseter, temporalis, lateral, and medial pterygoid. Next, corpus callosum. If you see corpus callosum, it is basically a bundle of white fibers or the axons, which is present between the two cerebral hemispheres, right? So what does this corpus callosum do? It is mainly responsible for the transfer of information. So it is a projection fiber. Okay, so it is a commissural fiber. So it is connecting the two cerebral hemispheres. It's not projection. It is a commissural fiber connecting the two cerebral hemispheres. So it has certain parts, isn't it? So what are the parts of corpus callosum? It has a rostrum. Okay, it has genu, body, and splenium. So you should mention about the parts and the connection. It is commissural fiber connecting the two cerebral hemispheres. In case corpus callosum is absent, it leads to split brain syndrome. So this you have to mention. Then styloid process of temporal bone. So if styloid process is asked, since it is for 5 marks, you have to mention about the styloid apparatus. So what does styloid apparatus consist of? First is the styloid process, which is present, which is a part of the temporal bone extending in the uh, uh, norma basalis. Okay, and it is a sharp pointed structure, and it gives attachment to 3 muscles and 2 ligaments. So these things you have to mention. It has a base, it has a body, and it has a pointed tip. Now, next coming to the maxillary air sinus. So it is present in the maxilla. It is the largest air sinus, okay, which is present in the maxilla. It is one of the paranasal air sinuses. And then you have to mention the bones forming the maxillary air sinus and where does the maxillary air sinus open into. So all these things you have to mention. Okay. Next, testis. So testis, it is a male gonad, right? And then you have to mention where it is located. It is located outside the body in the scrotal sac. There are 2 testes, and then you have to mention the parts of the testis, like it has an upper pole, lower pole, medial surface, lateral surface, anterior border, and posterior border. The upper pole is related to the head of the epididymis, okay? And then you have to mention about the sinus of epididymis, and you can draw a diagram. The coverings of testis also. Okay, so we have tunica albuginea, tunica vasculosa, and tunica vaginalis, which are the coverings of testis. So all this you have to mention. Next, profunda femoris artery. So profunda femoris artery is okay. So profunda femoris, it is basically present in the deep artery, which is present in the region of the thigh. It is a branch of the femoral artery. Okay, and it continues down as the popliteal artery, right? And what are the branches from the profunda femoris you have to mention. Then they are asking for the diagram of brachial plexus. So when diagram is asked, you have to begin with the root. Okay, C5, C6, C7, C8, and T1. So you will draw the root, and then you will mention about the trunks. Okay, and after the trunks, you will mention about the divisions and then the formation of the cords of the brachial plexus and the branches. So root, trunk, division, cords, and branches. So all this you will represent in a diagrammatic form. So this will be the short notes, which will be for 5 marks each. So wherever possible, please draw at least one diagram for each question here. Next, coming to the very short. So first we have the transitional epithelium. So in the transitional epithelium, as I already discussed with you, you can draw one basal lamina. On that, 3 layers of cells, and where it is present. Example of transitional epithelium is urothelium. So it is present in urinary bladder and urethra and all that you can mention. Then what is bregma? Bregma, it is the meeting point of coronal and the sagittal suture in the vault of the skull. It is a point for the presence of anterior fontanellae, which are the membranous covering, which later fuse and ossify after the age of 18 months. So all this you can mention about anterior fontanellae and where is the bregma located. Then what are the contents of the spermatic cord? So you have to mention all the contents of the spermatic cord which are being carried, isn't it? So all the contents from the low innermost layer, okay, the vas deferens and all the layers of peritoneum and all that. And once it comes out of the superficial inguinal ring, what are the coverings? All of that you have to mention. The nerves which are present, the ilioinguinal nerve, genitofemoral nerve, all these things you have to mention. Nerve supply of anterior 2/3 of the tongue. So here you will mention about the sensory supply, the motor supply, as well as the special sensation. So sensory supply is by the lingual nerve, motor supply is by the hypoglossal nerve. Motor supply means the supplying the muscles of the tongue. So that is by the hypoglossal nerve, and the special sensation is by chorda tympani nerve, which is a branch of facial nerve being carried by along with the lingual nerve. Then inguinal rings, here you will mention about the superficial and the deep inguinal ring. Where is deep inguinal ring formed? How it is formed? Where is superficial inguinal ring formed? How it is formed? What is passing from the deep inguinal ring? What is crossing the superficial inguinal ring? All these you have to mention. Then name the carpal bones. So all these 8 carpal bones which are present here, you have to mention those. You have to write those. You can start from lateral end. So lateral to medial and lateral to medial in the proximal and the distal row. All the 8 carpal bones you have to mention. Then sternum. If sternum is asked here, you can draw a diagram depicting the sternum having 3 parts: manubrium sterni, body of the sternum, and the xiphoid process. And then you can mention manubrium sterni. It is a butterfly-shaped structure. What are the structures? How does it appear? Okay, what joints it is forming? Like it is forming the sternoclavicular joint. So you can mention it is forming the sternoclavicular joint. It has a jugular notch, okay, or the sternal notch, right? And then you can mention the muscles which are taking origin from the manubrium sterni, muscles taking origin from body of sternum, muscles taking origin from xiphoid process. All this you can mention. Or you can only draw the diagram of sternum and there only you can write. Okay, so there only you can depict everything. So coming to broad ligament of uterus, so this is the peritoneal fold which is covering the uterus and it has 4 parts, right? So one covering the uterine tube is called mesosalpinx, the other covering the ovary is mesoovarium, like that. 4 parts of the broad ligament will be there. So you mention all the 4 parts and if you have time, you can draw the diagram. If not, you can just mention it's a peritoneal fold. It is the false ligament of the uterus and it has 4 parts and you can write all the 4 parts of the broad ligament. Next, coming to the interior of larynx. So if you're seeing the larynx, the interior of larynx, you will be seeing 3 parts of larynx. Okay, one part above the supraglottic part, okay, glottic part and the infraglottic part. So supraglottic part will be above the vestibular folds, which are the false vocal cords. Infraglottic part will be below the true vocal cords and the glottic part will be between the 2 vocal cords. Okay, so this you have to mention the 3 parts of the larynx, and then you have to mention about the oil cans of larynx. Then what is rima glottidis? What is rima vestibuli? Okay, this thing you have to mention. Lining of the interior of larynx you have to mention, and the nerve supply, which will be different in the supraglottic and different in the infraglottic part. So these things you have to mention. Rotator cuff muscles, so 4 muscles which are present around the shoulder joint. Okay, so we have supraspinatus, we have infraspinatus, we have TDs minor. Okay, right, all the 4 muscles which are present around the shoulder subscapularis, right? So subscapularis, supraspinatus, infraspinatus, and teres minor. All these 4 muscles together, they form the rotator cuff around the shoulder joint. So regarding these 4 muscles, you can just mention these 4 muscles together are forming the rotator cuff. Okay, like this, you have to discuss each question and you have to write based on the marks. Okay, so if it is for essays, you have to mention it. Uh, make it longer for 5 marks also. Suppose an essay question comes for 5 marks. Okay, in that case, you should know where to cut it short. Like for example, if axilla, okay, boundaries and contents of axilla comes for 5 marks. In that case, you can only mention the boundaries and the contents. You don't have to describe them in detail. But if it comes for 10 marks, in that case, you have to describe each boundary and each content in detail. Okay, so for 5 marks, you can just draw the diagram of the boundaries and contents of axilla and you can mention what are the boundaries and what are the contents. But for 10 marks, everything with the diagrams, 2-3 diagrams and detailed explanation is needed, right? So I think this will help you with the preparation for the exam. You can go through many other question papers so you'll understand what more questions you can be asked. You can also follow the question and the webinar series that we have on the exam preparation series and the other series that we have on our app, Prakara. Okay. Yes, I think any doubts, anybody? You can put it on the chat, I think. Okay. If you have any doubts or any queries, you can post it to us and we'll get back to you. And also, please follow our app for more informative content. Thank you.